Chair and Public Health Committee. Just so that you are all aware, this meeting will be webcast and the record will be retained on the Council website for up to 2 years. By participating in this meeting, you are consenting to your name, the content of what you say and your image to be broadcast and stored to the Council website. So if any of you, any member, any officer has a problem with that, please contact Committee Services immediately. For those of you at home who are viewing the webcast, and very warm welcome to you, I would like to inform you that if you look above the video, there is a resources tab. If you select this, you'll see a link to the agenda, and this will allow you to open the agenda in a PDF form, and you can follow the discussion and the debate. Right, I have received apologies for absence from Councillor McLaughlin. Anybody else? Councillor Cottier is on his way. He's late, so he apologises for being late, but he is on his way. Have we had any others? No. Okay. Thank you. Declarations of interest. Any members declare declarations of interest that relate to any items on this agenda? Councillor Jordan.
Thank you, Chair. I can declare an interest in the fact that I work for the NHS. My son works for the NHS and I'm a trustee of Inky Babies. Thank you.
Councillor Camphor.
Sorry, Chair. I just wanted some clarification. Do I have to declare my conflict of interest even though it is minuted?
But if you think that you do potentially have an interest in any items, then I would advise that you declare them.
Okay. So in that
Councillor Walsh.
I have a family member who works for the NHS.
Councillor Hagan.
I work for the NHS too, Chair.
Thank you. Okay. Thank you all for that. Minutes. You've all had the minutes of the meeting held on the 8th of September. Are there any comments on the accuracy of those minutes? If members are happy, can I have a mover and a seconder, please? Councillor Jordan to move. Councillor Hagan to second. Thank you very much. Now, we have had 2 public questions, and they're both in relation to item 9. So there, I have one which I need to read out, which I'm just trying to find, because the person, it's on the back of that one, right. It was a question from Christine Rothwell, who's unable to be here. So I will read out her question, which is that we are aware that an independent review was undertaken. Can the committee confirm it is a recommendation of this that a further review be undertaken? Although this report recommends a further review, there is no detail as to who will undertake the review, when it will be, or that key stakeholders will be consulted. It makes no reference to the most important people in this, those who use the service. Can the committee give assurance that this review will ensure that their views are taken into account? I most certainly can give that assurance. I think the other question is something similar, so we'll probably answer them both together. So we have, I understand Steve McGreal is going to ask his question. Is Steve McGreal here? Steve, thank you. You have 2 minutes to put your question. And if it is one that we can answer now, we will. Otherwise, you'll get an answer in writing.
Parent carers from the Council convened Family Engagement Group applaud the recent decision of the Adult Social Care and Public Health Workshop to provide Wirral Evolutions with an opportunity to develop the detail of their transformation model. Our goal is to see the best possible service provided to the disabled citizens of Wirral, regardless of provider, but we and the general public need to see that any decision is made objectively in the light of all relevant information. We note that Graham Hodgkinson has been or may be tasked with producing a report which undertakes a value for money review as to whether Wirral Evolutions offers sufficient added value to the Council in the delivery of the contract for day services for people with learning difficulties to justify the additional cost of running an arm's-length company. My question is, can we have your assurance that parent carers will be involved in the production of this report and that any other delivery model, including any in-house provision, will be fully costed and its services specified to allow full consideration, transparency and fairness in decision making? Thank you.
Thank you, Mr. McGrail. Yeah, I'm probably, you want to turn your microphone off now. Thank you very much. We get terrible feedback if you don't. I'm actually going to ask Graham to confirm, but certainly from this committee's perspective, yes, you can have an assurance of the involvement of all of the stakeholders in the report that Graham's going to complete for us, and we do take decisions with transparency. They're open, they're taken in this open public committee. Our reports are published. So I hope that will reassure you, but I will pass you on to Graham.
I would certainly confirm my commitment to involving the carers group in scoping the terms of reference for the report and including your views in relation to value. There's more to value than just the financial elements of the service, and clearly there's scope there in terms of value added as well in relation to the model. So very happy to talk to you about that and make sure that your views are taken into account as part of that process.
Thank you.
Thank you for your response. My appropriate follow-up question is, the original justification for Wirral Evolutions was that personalisation was driving councils to be commissioners rather than providers of services, and it would provide a great opportunity for improving outcomes. Does this council still believe that personalisation and improved outcomes for people who use the service and commissioning rather than providing are still as valid and important now as they were 7 years ago?
Great. Do you want to comment on that, or do you want to do a written response? I mean, I'm certainly happy to say that as far as we're concerned, the outcomes for the people who use the services are the key thing that matters to this committee. That the best possible outcomes are achieved, whether that is through whatever route, whoever provides the service. The question is always about, are the outcomes for people the best that they can possibly be? And that's what we're exploring, and that's why this committee has spent as long as it has looking and considering all of the aspects around this delivery of this service, and we will continue to do so until we're absolutely satisfied that what we're providing is giving the best possible outcomes. But I'm happy for the Director to add something to that if he wishes.
I would simply echo the Chair's comments there. I think that clearly outcomes for individuals is the key issue here. You'll hear in the report there are still ongoing concerns about proposed changes, and elected members have really expressed those concerns really because of the impact on people. Irrespective of how the service is delivered, the focus has to be on the outcomes for the people that use the service as opposed to the management structure or whether that service is commissioned or delivered. And in essence, we were charged with that as officers as part of the review process to look at all models of delivery and not simply commissioned models.
Thank you. It does occur to me there's a lot of people here who are here for item 9 on the agenda, and very understandably. So rather than to keep you all here, and I know that at least one of you has pressing commitments, pressing reasons why you need to be able to get on. So I'm proposing that we move, with the committee's agreement, that we move item 9 up and take it as the next item on the agenda, so the members of the public who are here can hear the item that they've come for.
Chair, there's a statement as well from a member of the public.
Oh, we have a statement. Sorry. Oh yes. So before, well, I'm still going to ask. I've still asked the committee about moving it up. So people are happy with that. Great. Thank you. So we will hear the statement from George Lamb, and then we will move on and discuss item 9 on the agenda.
Thank you for the opportunity.
Thank you, Mr. McGrail.
On behalf of the Save Highcroft Day Centre campaign, I'd like to thank the committee for letting me speak today. By now, the committee should have received and had a chance to read a copy of our survey report outlining the results of our survey. Its purpose was to give the wider community a say on the potential closure of Highcroft Day Centre, as well as provide further views from parents, primary carers, staff, and amongst others regarding the impact of the potential closures. Our survey also sought recommendations from participants as to ways in which Highcroft Day Centre could be saved. After 8 weeks of being open, 254 people took part in the survey, of which 211 were from the community. 15 parents, guardians and primary carers also took part in the survey, as did 5 staff members. Other participants included family members, volunteers and community organisers. The final details of our survey and how it was conducted can be found in our survey report, which we've made available to the public. For the purpose of today's meeting, however, I'd just like to summarise for the committee and the public the most important findings of our survey. Of the 254 participants who took part in the survey, 98% said they felt the service provided at Highcroft Day Centre is very important, and that Highcroft Day Centre plays a very important role in providing that service. 98% also said they felt Highcroft Day Centre and the services provided there were very or fairly important to the wider community. Finally, 96% said they felt very angry or angry about the potential closure of Highcroft Day Centre. Of the 14 parents and primary carers who completed the parents and primary carers section of our survey, 100% said they felt the service provided at Highcroft was very important. 93% said they felt the closure would have a very negative impact on the well-being of the service user they care for. And 100% of the parents and primary carers said they felt the closure would have a very or fairly negative impact on theirs and their family's well-being. Participants also said having the service provided at Highcroft gave them the opportunity for things such as respite, to go to work, do household chores, go shopping, care for other family members and to socialise. When participants were asked for suggestions on how to save Highcroft Day Centre, suggestions from them included opening the day centre for use by the wider community, for private events and for use by the community groups in the area outside its hours of operation, calling on Wirral Borough Council to do more to help save the day centres, and calling on Wirral Evolutions to advertise their services better and to explore alternative revenue streams such as fundraising events and fundraising initiatives. We call upon Wirral Borough Council and Wirral Evolutions to take the views and feelings of the participants in this survey into account when making any final decisions on the closure of day centres and on the future of the service, whenever that may be. But most of all, we call upon the committee, the council and Wirral Evolutions to continue placing the interests and well-being of service users at the heart of all their decisions in this process. Thank you for listening.
Thank you. Thank you very much, George, for that and for your very helpful and useful work that you did on that survey that we've all had a chance to have a look at. So thank you very much for that. Right, so we're now going to move to item 9 on the agenda. And I'm going to ask the Director to introduce the report, and then we'll have questions if there are any. I have to say, there are questions from committee members, I'm afraid, not from members of the public.
Thank you, Chair. The report in your packet, agenda item 9, follows on from the recent workshop held for elected members. That explored the detail of Wirral Evolution's plans to bring services back in line with the contract value. These included reduced staffing, a change in the delivery model and closure of 2 day centres. Members heard from carers in terms of their views, particularly views around the company and background to the company in the current situation, particularly in relation to the finances. Heard from the author of an independent report that looked at the plans and within that report there was really a focus on lack of detail to the plans, but also a very clear recommendation to provide time for that further development opportunity to develop those plans in much more detail. Members also heard from the shareholder board with regard to governance concerns related to the company. It was clear at the end of the workshop and really steered in many ways this report and the recommendations in this report that elected members continued to have concerns regarding the potential impact of the company's proposed changes and would like to work closely with the company to explore alternatives, looking at different ways potentially of reducing those costs. And in that context, there are a number of clear recommendations in this report. So I'll just go through those recommendations. First of all, the committee supports the decision of the shareholder board to hold a workshop with Wirral Evolutions to address governance issues. Secondly, to agree to extend the value of the contract with Wirral Evolutions for this financial year in the sum of up to £500,000. The idea of that is in order to enable further time to consider and assess the company's proposals to modernise the current operating model and reduce the operating costs. Third recommendation is to agree the request made by Wirral Evolutions to defer payment of the pension strain costs and the cost of support services bought from the council relating to 2020-21 to enable the company to have effective cash flow. Such deferment would continue until the end of the current financial year. Number 4 is to request at this stage that the proposals submitted by Wirral Evolutions should not be further implemented pending the governance workshop between the shareholder board and the company and a further report being brought back to this committee. And number 5, which links to that, is request that the Director of Care and Health bring a further report back to this committee following the Director undertaking a value for money review as to whether Wirral Evolutions offers sufficient added value to the council in the delivery of the contract for day services for people with learning disabilities to justify the additional costs of running an arm's length company. They're the 5 recommendations, Chair. Thank you.
Do we have any comments? Questions? Yeah. I did apologise in advance, Councillor Cartier, that you were going to be late. Any questions or comments? Councillor Jordan.
Thank you, Chair. With relation to recommendation 2, can I just ask if it's possible, and I don't know the logistics of this, but the last meeting the director suggested we found the £500,000 to bridge that interim period from the social care grant. And I was just wondering if that's going to be used so much for winter pressures, might it not be better to use the COVID money, given that Wirral Evolutions are saying they've been held up because of COVID?
Thank you, Councillor Jordan. There have been payments to Wirral Evolutions in relation to costs for COVID-19, so we have paid for those. Given the financial pressure here is partly to do with us as a committee making the decision that Evolution shouldn't implement the changes, then I think it makes a lot of sense for us to use the social care grant as opposed to COVID monies. You are correct that we are expecting winter pressures and winter pressure resources to be required. However, for some of those we will be able to use COVID money, so it's a bit of a balancing act about where we bring the money from. But in this instance, what happens is this committee's budget increases by £500,000 through the usage of that grant. So it does enable there to be no overspend within this financial year. As it currently stands, Wirral Evolution's additional costs are below £500,000. They're significantly less, but clearly we need the ability to be able to meet the additional costs that they're faced with.
That's fine, thanks. I just didn't want to find us looking for money for winter pressures if we've spent it elsewhere.
Yeah, me too, Mary. Councillor Gilchrist.
Thank you, Chair. When committee members met to discuss findings of the review, but also talk with Wirral Evolutions, we had a snapshot of the number of users of service, real people using real services, that Wirral Evolutions had interviewed and talked to in part about the future direction or where they might go in future, each of those being an individual with concerns and needs. At that time, my recollection is that probably 60 people or so had still not been interviewed, partly because of access, partly because of COVID, partly because they may not be able to come back into the service. I'm wondering just how much complete information we've been able to gather more recently, also to seek assurances that whatever we ask, despite them being a separate arm's length organisation or whatever we ask for them, we're able to get them to provide us, so we are in the fullest possible picture as to what might be going on, what they're providing, and how the service users feel.
Councillor Gilchrist, I'm sure if we ask for information, the company will provide that to us. They have been very cooperative with us in providing information, so we can address that with them.
Councillor Camphor, then Councillor Cannon.
Thank you, Chair. My question relates to point 1, which is about the shareholder board. And I would seek clarification that currently the shareholder board comprises of 3 shareholders. Would it be wise, given the history of what's happened, to perhaps widen the shareholder board for greater scrutiny and increased governance? Thank you.
That has been discussed by Policy and Resources, and the decision was taken to retain the shareholder board as it currently stands. Do you want to add to that, Vicky?
Chair, there's not a great deal I can add to that. The shareholder board is a subcommittee of the Policy and Resources Committee. At the moment, under the Constitution, it is to be made up of 3 or more members. And as Councillor Nolan has just said, there was a discussion very recently at Policy and Resources about the size of that subcommittee, and at the moment it remains at 3.
Thank you, Chair. I think, you know, it's been a very difficult situation, and I think I'd just like to thank Graham for coming with these recommendations to the committee, because I think it has given us the assurance that we needed to go forward. And I think especially in the point, sorry, just sharing the screen, I think especially with the point that no implementation of closures or job losses will occur at the moment. So I'd just like to thank Graham for that, and hope that all of the guests here today are reassured by this sort of interim period of review, and that we will come back and keep all of your best interests at heart. So yeah, I think I was just reassured, having been part of this journey for a few years now. I think this is sort of a really good opportunity for us all this evening. So thank you.
Thank you. Yes, I hope that that people are reassured that nothing's going to close right now, and that we're not suddenly going to see a reduction in staff numbers. So things will remain as they are. The ship will be in a steady state whilst we look at the governance of Councillor Walsh and then Councillor Mountney.
Thank you, Chair. It was very powerful to hear from the parent carers about the service and how much it's loved by its users and the difference it makes to the lives. And I'm supportive of extending the value of the contract by up to £500,000. The current plans from Wirral Evolutions have obviously been reviewed, and they do need more clarity and detail, but I do think we need to see some more entrepreneurial spirit for Wirral Evolutions to use their assets to create more new funding opportunities, which I don't think is covered off too much in the report. We've seen from the Save the Hive Croft campaign that the day centres are vital for our communities and are much loved by the users and families. I would like to see this time used in a way that creates a plan to keep it open all of our day services, and we clearly need to see more cooperation and collaboration from the Shareholder Board and Wirral Evolutions if we're going to be able to provide the best possible outcomes for our users of the services. And there's just one survey response from the Save the Highcroft campaign that really stuck with me, and it was, "It gives my son a life." And I think if we take these services, or reduce the services, or reduce the overall number of centres we have, are we taking that away? And I think we should have that at the heart of it, of this debate. And obviously it's very encouraging that they will stay for now, but I would like to see a plan that sees them stay for longer. Thank you, Chair.
Thank you. Any other comment? Oh, Councillor Mountney.
Chair, thank you. Just looking for some reassurance really from the Director. I spoke towards the end of the last meeting about whether there's a will, this Council has the wherewithal to make things succeed. But from one of the previous answers where the Shareholder Board is remaining as was, there doesn't seem to be any more new heads in the pot, so to speak. I don't know whether the Director can assure me that officers of the Council are getting more involved in this to bring some reassurance to both him and us that things might be moving forward. I can't see things moving forward if all the players on the table stay the same. Things might just stay the same.
Councillor Mountney, I think some of the issues you raised are matters that we intend to discuss at the workshop. Recommendation 1, which is to support the recommendation by the Shareholder Board that there is a workshop to look at governance issues, and that will address the relationship between the company and the local authority and various options that may be open to the local authority and to the company.
Will that meeting be minuted?
It won't be a public meeting, it's a workshop, but I'm sure we will be taking some notes and there will be some outcomes from that meeting that will be shared.
Any further questions or comments? No, in that case I'm happy to move. Support for the recommendations. Do I have a seconder? Councillor Frost, thank you. Okay. Thank you. And for those members of the public who've been here for that item, I hope that that's been satisfactory, and I hope you've heard some of the things you wanted to hear. You are more than welcome to stay for our meeting, but equally we won't be offended if you leave. We're now going to move on back to where we started, with item 5, Shared Lives Commission. Jane?
Thank you, Chair. Good evening, councillors. This report provides a summary of the outcome of the review of the current shared lives model on Wirral and requests a review of the current fee model. The report includes an officer recommendation for future service delivery. Wirral has had an outsourced shared lives service for many years on Wirral, and the current model has not enabled us to increase our ambition for the numbers of shared life cases that we've got on Wirral. We have considered a range of options that are set out in section 2 and section 3 of the report, and our preferred option is at 0.3.8.4 in the report. We are ambitious to grow over an 18-month period the numbers of people who are in receipt of a shared life service as an alternative to other service models like residential care. Our current service offer is mostly long-term placements. What we want to be able to do is expand the offer and the scope of the service to include daycare and increase short breaks for carers. The costs in the report represent investment into the establishment of an in-house team to be working within the council, with costs to be met by the adult social care budget. Whilst the costs are more expensive to set up the team, we anticipate, based on our research in other areas, that this will deliver efficiency if we can meet those increased targets of placements to other alternative models. To achieve this, we would like the committee to authorise approval to develop an in-house shared lives model with a complementary framework of external providers to support the growth of an in-house service, and give approval for a further future report to committee to provide detail on that developed option, with a request for decision to proceed with the new service model during the next financial year. We'd also ask that committee approves the review of the current banded fee model for an alternative model as part of its annual rates and fees negotiations, which commence within the autumn of every financial year. Any new service, of course, would need to be set within a regulatory framework and be CQC registered. And to enable us to achieve this extended piece of work, we would look to extend the existing contract to March 2022 to complete.
Thank you for that, Jane. That's a really exciting development, and one that's definitely well worthwhile. Any comments? Ampha?
Thank you, Chair. Yeah, I commend that report as well. My questions are really about the issue in 3.3, which is adults with autism and older people, including people with dementia. Could you assure me as to what level of dementia and level of autism will patients or residents be eligible for this kind of service? Because I'm aware that there can be a huge variation, and just by screening them into a small section, it may not be helpful for the rest of the patients with dementia or autism for that matter. Thank you.
Thank you. We do currently have 40 shared lives placements on the Wirral, and they do represent a real breadth of need. Some people very able that live with a family are unable to go out, access work and training, and some people who are very dependent on services and do have more complex needs. We don't have a lot of older people within these service areas at the moment, but that is an area in particular that we want to grow, especially for day care services so that we can provide daytime short breaks for people. So dementia is one of the fields that we would want to train our carers in and develop that service offer so we can widen it out to a bigger population.
Councillor Mountney.
Thank you. Could you ask, in 310.1, you say that we go from 40 long-term placements to 80. How long does it take to recruit the host to do that type of work? Is that a quick process, a long process? How much training do they need? And where are we, vice versa, with demand at the moment from 40? How do you see that growing to 80?
Thank you for your question. The recruitment process for carers, based on our research, can take anything from 2 to 6 months, depending on the need of the carers, to get them up, registered, working. Some can go much quicker. We do already have some carers who are already trained but don't yet have people placed with them. So we do want to set an ambitious target of doubling the numbers that we've got, and we think with an assertive recruitment campaign for carers with group training, group setup, we should be able to make that within an 18-month period.
Councillor Jordan.
Thank you, Chair. In terms of the quality of the care, you say that they will be assessed by the CQC. Does that mean that they're going to go to every house?
What was the last bit of the question? Sorry, Councillor Jordan.
So if the CQC are assessing these carers, I take it, are they actually going to go to every house?
No, so the regulated element of that will be for the council. The council will need to set itself up as a regulatory with response to as a CQC registered service with regulated activity. It will then recruit and train carers on its behalf to deliver shared life services and provide supervision and oversight for them.
So it's a bit like a childminding facility. It's a similar model to childminding.
It's a similar model to an adult fostering service.
Councillor Camphor.
Thank you, Chair. I just wanted to learn a bit more about the training you will offer these carers and the ongoing mentoring and perhaps even appraisal. Can you assure us that this will be an ongoing training format which will be reviewed perhaps on a yearly basis so that the quality of care that's provided to the most vulnerable in our society is of good standard? Thank you.
Thank you. Yeah, the training and supervision and appraisal framework is set out within the regulatory framework for the Care Quality Commission. So that enables us to work with shared lives carers as if they were staff members. So they will receive supervision, annual appraisal, personal development plans, and they'll have staff within the council, if the model is developed and approved, that will be able to support them with their development and training. It will also enable us to give them access to our own organisational development framework and e-learning and face-to-face learning as well, so we can be confident about what is being delivered.
Councillor Gilchrist.
I think, if anything, even a year or so ago, the government issued a paper about how it saw care and caring becoming a real profession again, with people paid adequately and with real training. So I think, in many ways, we're now reinventing or putting back together things that were dismantled some years ago. So I can see that as an authority, as a council, we're now getting back together things that were just hived off, put simply, commissioned, passed to other people to do, and getting ourselves into the detail of things. That clearly has its pros, advantages, but also it means that we've got to build back some of the things, some of the capacity we haven't had in the past. And that I'm thinking in terms of training and supervision, those things that have just been touched on, because now we become more directly responsible for a whole group of people doing this work directly answerable to us. So I think the assurance members would like is knowing that this is all going to be in place and that we really are getting our feet under the table is probably the right phrase, in order to keep tabs on all that we're now going to be doing in future.
Thank you. Yeah, the proposal in the paper is that we bring back a worked up model of our recommended option, which will, I think, provide another level of assurance for members at a future committee date, and will provide more detail on the underpinning framework of development, organisation, supervision and oversight of this service.
Councillor Walsh.
Thank you, Chair. I think it's an exciting opportunity for the Council to build on its wealth building strategy, and I welcome the in-house model. And it'd be very welcome to see it expand from 40 to 80. But given that the financial year 22-23 will be on us very soon, is it enough time?
I think when we bring the future paper back, we'll need to take careful consideration of the timescales. Our ambition is to start within the next financial year. So the paper will determine which bit of next financial year, because it is a substantial task to set up a regulated activity. But we are hopeful that we can bring that through to next financial year.
Councillor O'Hagan.
Hi, yeah, I was just wondering with regards to the Shortbreak Beds, have you ever actually had to turn anybody away who's needed them?
The current shared life service doesn't provide big numbers of short break services currently. The vast majority of our current offer is for long-term placements. So for short-term placements or for short breaks, there's the matching process can take some time to deliver that. So it's not something that we currently offer a lot of within the shared life service.
Right, so it's no further questions. Do have a mover for the recommendations?
Happy to move, Chair.
Thank you. Seconder? Thank you, Councillor Jordan. Thank you, Jane. I think the next one's you as well, Jane. Commissioner Activity, Quarter 3 and Quarter 4.
Thank you. This report is to update members on Quarter 3 commissioning activity for adult social care in relation to the procurement of short-break beds for carers support. The request is that the committee delegates to the Director of Health and Care Authority to undertake a tendering exercise to procure short-break beds to support carers, and that the committee delegates authority to the Director of Care and Health to grant tender to the successful bidders following a tender process for the short break beds with a contract length of 1 year plus a 1 year extension option at a maximum cost of £641,000. Prior to the pandemic, the department used to commission 15 short break beds. Of course, during the pandemic, we've seen a slowdown of numbers going into care homes either for a short-term or a long-term basis because people have preferred to stay at home. We're now in a position, though, where services are beginning to remobilise and requests are coming forward for short breaks for carers, in particular for older people. Prior to the pandemic, we did have 15 short break beds commissioned, but based on the occupancy data, up to the pandemic date, what we can see is that we think 11 beds will currently be sufficient to meet demand. We do need to put these services in place to meet a statutory Care Act duty to support carers. The short contract length is due to our current thinking in relation to we have a high vacancy factor within the care home market that's currently running at 19% vacancies. Prior to the pandemic, we used to operate between a 10 to 12% vacancy factor in the market. So that, because of the pandemic, that's increased. What we don't yet understand is what this next winter will bring in terms of vacancy to the market. So we're only going for a short length contract to enable us to review that at the earliest possible opportunity to look at any future requirements. So our ask is that our recommendation is that we just go for a contract length of 1 year plus an option to extend for a further year, dependent on what the outcome and occupancy take-up of those beds is.
Thanks, Jane. Yeah, we had a discussion around shortbreak beds, didn't we, at the last committee? I didn't think I'd made that up. I thought we did. So this is the next stage, really. We're now asking for the authority to go out to tender. Okay, yeah. Okay. I'm assuming this will be the tender process will be for providers who are already on our framework. Yeah.
Yes. Just to confirm, the previous report was a report about carers, with a recommendation to bring back a further report about shortbreak beds. Yeah.
Councillor Mountney?
Sorry, it'd be remiss of me if I didn't ask. It's a 30% reduction, and I'm not informed, but from the uninformed perspective, I've just got a nagging doubt that there's lots of people at home now that have put up with the pandemic for 18 months and might suddenly come forward. Is 11 enough, is the question.
Based on the data pre-pandemic of the numbers of people who did take up when we had 15 beds, we never maximise more than 10 beds at any one time or over an average period. So we've gone for 11 beds because we think that will be just slightly over more than we need, but we will keep that under review based on the current occupancy data pre-pandemic.
Right. The committee happy with the recommendations? Can I have a mover and a second, please? Councillor Jordan to move, thank you. Councillor Frost to second, thank you very much. Right, item 7. Graham, this is the performance report, if you want to introduce that. Normally Jason's. Oh, you give it to Jane. Right.
Thank you, Director. Thanks, everybody. Yeah. So, members are asked to note the content of the performance report, and what I've done is pulled out some highlights from the report that I think would be of interest to members. What members can see is our continued reducing numbers of residential and nursing placements. We have had a slight increase in July, but that was due to the remobilisation, I think, post-pandemic. We do have a 19.9% vacancy rate within the market, which is higher than it was pre-pandemic. We currently have 7 homes closed due to COVID infection, which we are working closely on with our colleagues in public health and infection prevention and control services. We've had 66 alerts to CQC, and the outcomes for those are recorded in the report. We've had a slight increase in the numbers of direct payments recipients, and we are launching a targeted piece of work to further increase those numbers over the next 12 to 18 months, so we can increase the number of people with a direct payment. We're ambitious in that area. In terms of transfer to assess, we are just completing the transfer of those beds over to that NHS discharge to assess model on the Clatterbridge site, and we are just finalising our 30 beds transitions commission that will go live from the 1st of October. Our domiciliary care sector continues to grow to meet demand. although it is facing some current challenges in terms of recruitment and retention, but we do have a targeted plan to support our market to continue to grow in that area. Reablement as a key focus is on the agenda in a report in its own right, so I won't touch on that here. Our supported living offer remains relatively static. In relation to the last, one of the previous committee meetings, members did raise a query in relation to a Mental Health Act indicator for CWP, KPI number 17. And a member briefing was provided after that to update members on that. Just to say that KPI will be replaced with an activity measure, and the measure will report on the number of assessments that have been completed per month and not the number that are within time scale, given that the delivery of those Mental Health Act assessments is not determined only by the CWP staff, but also around other statutory services that are there to enable and support that assessment. So we are changing that KPI number 17 into an activity measure going forward.
Any questions, comments on the performance report?
Yeah, thank you, Chair. Thank you, Jane. I'd just like to say thank you very much as the way it's been presented. We've been asking to be refined, and certainly on the alerts and the notifiable incidents as well. It's very, very clear, and I've been asking that for a while. So thank you for that. Cheers.
Yeah, thank you, Chair. Tucked away in the data, I looked at the particular pages about the KPIs to do with the Community Foundation Trust and CWP. And I think in recent occasions, I've been looking at the number of individuals who've had their annual reviews completed. And so those tables, because of time collecting data, both get as far as the end of June. And in the case of CWP, there's like 69% have been completed, 814 out of 1173. And in the case of the Community Foundation Trust, it was 60%, so 3,657 out of 6,090 or thereabouts. So what I'm wondering is if we have more regular updated data that will show us what progress is being made, since those reviews were one of the foundations of making sure people had the right level of service, but also making sure that we were monitoring our budget closely. So I was wondering if there might be a way of, instead of getting data which was collected in June and made available recently, we can catch up a little bit with some recent data. Perhaps we could have an email with some of the most recent data so we can see how things might be going. Thank you.
I'll take that request back.
Thank you, Chair. First of all, I'm glad to see there's been some action on KPI 7. It's still staying that zero number of mental health assessments are completed within timescale and zero completed at all. I'm just concerned that, which is it? Is it none are actually done or none are actually recorded? Because if it ain't written down, it didn't happen, as the old adage always says. So that's my first question is around that KPI. My other one is, it's great to see people moving from staying in residential accommodation to staying in their own home with the support package from domiciliary care. And I have some concerns on the quality of domiciliary care that's currently being delivered. I know it comes under the CQC, but I still know that there are people who get 7 minutes, which is obviously not sufficient. And I just wondered, what are we going to do to ensure that quality care is given to people in their own homes. And the final question I would have is, we still have a situation where half of our care homes are rated good or outstanding, therefore half are not. Do we have an action plan to get somewhere with that?
Thank you for your question. In relation to the mental health indicator, where we, and it hasn't been reported as such in this report, but that will be turned into an activity measure. What I can assure the committee of is that the Mental Health Act assessments are being completed and that people are safe. In relation to recent activity in July, there were 13 community treatment orders completed, 15 Section 2 assessments, 9 Section 3 assessments, 1.5 Section 136 assessments and 17 other Mental Health Act activities that were delivered, so that would be helpful. In relation to the domiciliary care, where we do have concerns about the quality of domiciliary care, we are working closely with our quality improvement and assurance systems, with our contracts and quality team, to intervene and put targeted action plans in place, working alongside CQC to improve the quality of those services. And we're also working closely with homes that are both requires improvement and inadequate to improve services, again with a targeted intervention from our quality and contracts teams to enable us to do that.
Thank you, Jane. Just before I ring Councillor Walsh and Councillor Cannon, I'm intrigued, how do you do 0.5 of Section 136?
I think it depends how long it's gone over in terms of the counting, whether it's a 28-day month or a 31-day month. I think it depends how we count it through.
Thank you, Chair. I just wanted to ask a question around the transfer to assessment, and there's some useful information around the people using the service and how long they're there for. Is there a wait time for how many people are in hospital waiting to get into those places, or is it immediately available? Because obviously it then has a knock-on impact right the way through the NHS, doesn't it?
It does. We do provide for hospital discharges a focused team, in particular a multidisciplinary team, working to discharge people from acute settings into transfer to assessed beds, discharge to assessed beds. We also prioritise domiciliary care cases for people moving out of discharge to assessed beds, so we can always create capacity within those beds. As of this week, of the 101 beds that we did have commissioned, yesterday I know that we did have 20 available beds, and they continue to move through. We're currently in this transitions process of moving to this new NHS-led model with the 71 beds at Clatterbridge. So we're scaling down the existing commission, and then we'll be scaling up the new 30-bed commission over winter. But we have almost always, got capacity within our discharge to assess beds, and those beds are prioritised for discharges.
Thank you.
Thank you. Thanks, Jane. It was just following on actually from Councillor Jordan about reablement and the ends of reasons for those care packages. I mean, obviously, it would be wonderful if the reablement worked and we actually had a lot more people sort of having no further ongoing services. But I suppose that's probably my question really, is there's not a huge amount of detail in it, maybe because you don't have it. It says no ongoing services, but it doesn't really say whether those residents have actually been reabled. It just says that there's no longer any services going on. I think if it was possible to have a little bit more detail, and as well as what's actually the ongoing care at home, whether that's then had to go on to have further carer input after that 6-week reablement. I think I was just after a little bit more detail, because I'm sure we'd all love for that percentage to be really high and people to have actually been reabled in our communities. Thank you.
Yeah, I'd be happy to bring back some more information on that. I'll take that as back to our team.
Councillor Mountney then.
Thank you. On page 21, which is the number of alerts sub-theme, I'm sorry, there's probably lots of sensible answers, but of the 66 alerts, 44 are highlighted as abuse or alleged abuse or serious injury. Can you just explain what, because that is concerning, but I probably don't know the background.
So care providers, if they experience either safeguarding or issues that may be of harm to service users within their services, have a duty to report to the Care Quality Commission. We have an internal process where we're able to separate out what are care concerns relating to the provider and safeguarding concerns relating to the individual. So either way, those 66 alerts will have been responded to by both our social work services and our quality team.
Okay, but those 66, the 44 then, of highlighted as abuse or alleged abuse or resulting in serious injury, that's what happened, is it? There was abuse or serious injury occurred?
They're alerted as safeguarding referrals, which will trigger an investigation, and then the outcome of the investigation for the safeguarding referrals is also in the report.
Sorry, Chair, I'm not really understanding that. So were there 44 people were abused or allegedly abused and suffered serious injury, or some suffered serious injury?
Yeah.
Yeah.
Sorry, that's the number of alerts that went to CQC. That if there is a safeguarding concern, they do have to report that to CQC. The outcome of the safeguarding referral might not be that they were the victim of abuse or serious injury, but it has triggered an investigation.
Should I not be really concerned about that?
I don't think the concern is about the number of alerts. The alerts isn't a bad thing. The alerts is that it has been raised with CQC. It's the outcome of the safeguarding investigations that I think is the critical thing, and the outcome of those safeguarding investigations.
Sorry, thank you. I'm beginning to understand. So at some point you get a full report on that, do you? Do we get to see that, Chair? I'm sorry.
You get the figures, and they are in the report, they are in the performance report, the outcomes of the safeguarding investigations. No, you don't get them. Councillor Jordan.
Thank you, Chair. Can I just follow on from that on the safeguarding? When we're talking about abuse, then obviously I get that you're talking about people who are being cared for, but I also wonder about people being abused who are doing the caring. Are they somewhere in some report somewhere? Because we know that it's happening and it's increasing.
Is it a question in relation to paid or unpaid carers?
Well, both really. If anybody's being abused who's caring for somebody.
We don't currently have that data with us, but we'd be happy to take it away and bring some further information back.
Councillor Camphor.
Chair, just a quick question. Can I respectfully ask, why do you not have that data? That is really important. And if somebody is being abused, if they're a carer, it's really important to support them. And we've already talked about mentoring and appraisal and so on and so forth. Shouldn't this be all part of it? And if we have not been doing it, I want to know why. Thank you.
Thank you. The report has been built up at the information that members have requested. If that is something that members would like to request, we could build it into the report.
So I think there are some important distinctions here, aren't there? So if a carer, an unpaid carer, is abused by the person they care for, then they will be included in these statistics because it would be a case of a safeguarding incident. For paid carers, I think the process is different and wouldn't be included as safeguarding. It would be included as a health and safety issue at work. So very different treatment of those two different situations. The key thing with safeguarding, however, is really the focus is very much on vulnerable people. who are being abused as opposed to the workforce. So there is a very different focus. I think we would have to really be careful to define the scope of that particular request. Thank you.
Any further questions, comments? No. Right, in which case, can we, I think we're requested to note the report, and we have highlighted areas where we want further clarification, so I'm happy to move that. Can I have a seconder? Councillor Gannon, thank you. Right, that takes us to item 8, budget monitoring. Over to you, Graham.
Thank you, Chair. I'm not going to dodge this one.
No, you're not. No, you're not.
This budget report paints a positive picture of the stewardship of the budget through this committee for the period between April and June 2021-22. It reflects positive progress in implementing activity linked to how resources are used to support vulnerable people and service effectiveness. The forecast is a positive variance of 0.61 million. The context, however, of the report is really important. We are, as everybody knows, still in a worldwide pandemic and responding to that. We are seeing continuing increase of demand at the moment and are experiencing significant pressures through our General Hospital, Wirral University Teaching Hospital. There are very high levels of admissions and discharges at the moment, so we are seeing significant numbers of people leaving hospital with the requirement for support. There is some support for funding those packages in the short term from the NHS, which has been continued beyond the original deadline, which was this month, September, but it's being continued through the financial year. So that's been very good news for us financially. But we are now heading into winter, and that does tend to be the period of highest demand for adult social care. So I think in summary, it's important to say that this is a very positive forecast, that the plan changes are being made as expected, but we do need to have a note of caution, which is around the ongoing pandemic and the winter pressures that we are currently unlikely to experience more of.
Thank you, Graham. Any comments, questions for the Director on that report? No. One of my concerns, I have to say, is that the slippage on the capital programme, which I know has been inevitable because of COVID, and I have a concern that that may continue to be an issue, as we know that supply chains all over the place are falling apart for various reasons, and I'm concerned that that will continue to slow down our capital programme, and clearly because we've had a couple of planning applications for our extra care housing turned down recently. That will have an ongoing impact on our budget, because obviously, you know, we're supporting and having a programme of development of extra care housing, because that's the right thing to do, and also because it's in budgetary terms, it's advantageous to for us to have extra care housing rather than residential. So hopefully those issues can be resolved going forward, and we can move on with the capital programme. That would be my only question.
Thank you, Chair. Yeah, there are some elements in our control and some elements out of our control. Certainly in relation to digital technology, the kind of some of the elements there are pretty much out of our control in terms of supply and demand. Some of us have been waiting for our new car for a very long time, but that's a separate issue altogether. So those things are out of our control. But in terms of the extra care housing market, then there was a discussion recently, and I think that we will work to make those plans as rapidly as we can, and look at alternative build models with providers as well, to make sure that all options are considered in terms of how the developments can be progressed.
Thank you. No further questions? Right, I'm happy to move recommendation. Have a seconder? Councillor Jordan, thank you. Item 9 we have dealt with. That brings us on to reablement, the community reablement review. Jane, this is an interim report, I understand.
Yeah, thank you, Councillor Nolan. Yeah, this report is to update committee on the outcome of a review of reablement provision on Wirral, including analysis of potential alternative models. And the report is to request members' views on the current reablement service model and whether consideration is to be given to developing an alternative future model for delivery of reablement services in Wirral. And just to confirm, it's not a key decision. Our current reablement offer forms part of our Care and Support at Home Commission, and the current cost of our reablement offer, including the assessment element provided by the Foundation Trust, is around £2.7 million a year. We've undertaken a research and comparison exercise with other local authorities and other models across the North West. Our current model, which is a hybrid model of having the assessment undertaken within the community trust and the actual delivery model of the reablement undertaken by our domiciliary care sector, it results in an average length of 3 weeks, around between 21 and 23 days being on the reablement model before people move off the service. 38% of people who are in receipt of the service leave the service with their reablement aims achieved and requiring no further support. Our research determines for us that the current model is both efficient in terms of the numbers of people moving through it and cost effective in the way that we procure and deliver that service. The service has grown 22% from financial year 1920 to the full financial year of 2021. Our research has shown us that it's identified further opportunities to look for comparative data across other sectors and to explore other models. What we did find in costing those models, comparator models from other local authorities, that those models would incur additional expenditure to our current model. Our current service is in contract. The contract for the service, the Care and Support at Home contract, is a 5-year contract to run from 2019 to 2024. And in 2024, we have a further option to extend for 5 years. Our current model brings additional assessment and ongoing assessment opportunity by including trusted assessment post the reablement intervention, which enables providers to undertake reviews and make recommendations for social work services on any further reductions or increases indeed in packages of care if that's the right outcome that a customer needs. We've had some very positive feedback, which is included in the report, from our current incumbent providers. And what we are actually asking for in terms of a recommendation from the committee is that the committee is requested to consider the content of this report and to provide a view on our current reablement service model and whether consideration is to be given to developing an alternative model for delivery or reablement services on the Wirral.
you wish to add anything to that, Graham?
So, thanks very much for the work, Jane. Clearly the recommendation really is to, I think, do some further review work in relation to the current model of service delivery. We're not clear really from the review whether the service is best in class, or how it compares with broader models in other areas. And I think that some more work on that, and recognising the importance of taking in the views of people that have had access to the service, that have used the service, their views in relation to how it's been provided to them, I think would be very important in undertaking a fuller evaluation of our service model.
Thank you. Thank you, Jane. That's helpful. Yeah, I'd certainly like to see some further work done, because what this report doesn't tell us is the criteria that have been used to determine the people who are eligible for reablement. And I know that varies. Again, it's when you're doing the comparison with other local authorities. Some local authorities take everybody, literally everybody, will be offered reablement, and in other places people are selected on the basis of certain criteria for reablement, and we don't have that information. And I have to say, being fully reabled in a period of 3 weeks would make me think that people who are entering this service are people who are already pretty much on the way to recovery. So certainly further report will be very welcome, and we'll have more information. The committee will be in a better position to look at that. Any further comments, questions? Councillor Jordan.
It's me again. Yeah, I suppose this is something that I feel quite passionate about. I agree with you, Chair. 3 weeks is not very much to re-able somebody, and I would say that it's pretty basic. That they're obviously not starting from a very low baseline. My sort of sphere of interest lies more in rehabilitation, particularly rehabilitation following critical illness, so following the NICE guideline 83. And I think the pandemic has thrown up the need for this now, that so many people have found themselves in ITU, on ventilators. The fact that people then suffer severe psychological damage having been on a ventilator and can carry on with that damage for years, at least 2 years, and usually that's covered in a note to the GP saying had a rough time in critical care. So the model that currently exists across Cheshire and Merseyside is a level 1 model at Walton Centre, where if you get knocked down by a bus tomorrow, that's where you'll finish up after your hospital treatment, and then step down to level 2. There's a level 2 facility at St Helens for anyone registered north of the river, but for anyone registered south of the river, there is no facility. And so people are then discharged back to a DGH or home. And we obviously have a gap between reablement and proper rehabilitation following critical illness.
Yeah, thank you for your comment. I think that would be something for us to consider as part of any future commissioning, joint commissioning requirements, in particular when we look at the development of integrated systems locally.
That's exactly what I was going to follow up with, actually, to say that might be something that the ICS might care to take on board.
Thank you, Chair. I just wanted to ask a question to try and understand why there's such vast differences in the overall annual cost. I can't really see the reasons for it in the report. I know it's not completely detailed with that, but I'd just like to understand a bit about that, because I would like to see more information explored, especially the council-led model. When I've talked already this evening about community wealth build, and this provides us with another opportunity to potentially bring something, to help the Wirral pound and the Wirral economy, an opportunity to strengthen it. Whilst it might come at a greater cost, that cost might then be, brought back into our local economy. So I'd just like to understand why there's such a vast difference, is probably my question to you.
Thanks. The comparator costings that we've undertaken are based on the costs and gradings of staff at certain levels within each of the alternative models. So the higher costings are the ones where they're the higher service and staff payments, like the NHS, and also with the council, with the Green Book requirements to pay staff. So our current model, which is all provided by Wirral-based providers and not national providers, they're all Wirral-based providers, so also bringing some community well. It is a more cost-effective model, because even though we've just also introduced the real living wage there, it is still more cost-effective staffing-wise than paying staff either in the council or staff within the NHS. But I do take your point about the future and what that might bring.
We have no further questions or comments. The recommendation is that we consider the content of the report which we've done, and consideration and whether consideration is to be given to developing an alternative future model. Does anyone want to move anything on that?
Can we do more on the council-led model? Can I propose that?
Interesting. The recommendation asks whether consideration is to be given to developing an alternative future model. Are you suggesting that we ask officers to do that?
Yes.
Yes, thank you.
Bring that report back to future committee.
Thank you, Councillor Nolan. Can I just highlight the risk within the report of that we're already within contracted services until 2024. So there would be some risk to the council if we were to extricate ourselves from that contract. But I think it would be appropriate for us to work up that model within the remaining contract period as part of the recommission.
Yes, that information was in the report, so I think we're aware of that. Thank you. Right, item 11 is the COVID response update. Julie's on holiday. Elspeth's unable to be here, so is that down to you, Graham?
Thank you, Chair. Yes. So this is the report of the Director of Public Health, and clearly brings an update to this committee. And the committee is asked to note the contents of the report. In 3.1, the report relates to the outbreak management plan. It is available to everyone on the council website, so I think that it does provide quite a detailed amount of information for members of the public and for elected members as well in terms of that management plan. Section 3.5 provides an update of those plans, and I would ask elected members to note in particular the focus on effective engagement with communities, and I think that's a very important part of this plan. There is quite a lot of detail in the report relating to 11 areas of activity, and I would pick out a particular issue which relates to this committee's work, which is the vaccination of care home staff My understanding on the current data is that 94% of staff have had their first vaccination and 83.3% have had their second vaccination. So I think there's been really good progress there. Clearly I won't go into any more detail, I don't think, in terms of the content of the report, and leave it to elected members. And if there is detailed information required, if Jane and I can give that, we will. Otherwise, what we'll do is we'll defer to our public health colleagues and provide that information for elected members as requested.
Thank you. Thanks very much for that, Graham. I would just like to comment, just perhaps to inform the committee, because you may well have had the same kinds of concerns expressed that many of us have about the anti-vaccination activity at schools, of people handing out leaflets to the children at school gates. Just to say, we had a report at the group leaders meeting today that Mark Camborne is leading our response on that. He's working closely with the police. The police are having a presence at school gates, and we are discussing with the police whether or not they're able to take action under children's legislation in terms of actually intimidating and trying to coerce children, which is actually illegal. So that was where things were at lunchtime, and I know that Mark said that we were expecting a force-wide position to have been taken by the police by the close of play today, so we would know that they were taking action right across Merseyside in respect of anti-vaxxers at school gates. Just a thought that I thought people may well have had complaints and be aware of it, because I certainly have. Councillor Frost.
Thank you, Chair. No, I appreciate the update, as I'm sure many members have been contacted by parents and then staff also at schools. It did surprise me, I think, that the police didn't feel immediately armed to take action, because to your point, coming on school property and then engaging with children without the consent of their teachers and without the consent of their parents struck me as immediately a clearly illegal act, but really helpful to know, I think, the direction of the action that they're trying to take. I think the intent of these people to engage with children without their parents' consent is really, really concerning. So I appreciate the update. I know you've only just had that feedback this afternoon, but if you could keep us all informed of the rest of the conversations later today so that we can keep in touch with our residents who've been in touch, that'd be really helpful. Thank you.
Yeah, I mean, I think it is. It obviously is very concerning, and but the last thing we want is for parents or teachers or head teachers to actually engage, because that's when we get into all sorts of trouble. So we don't want incidents. So we are advising people just to ignore them, to tell their children to ignore them, to walk straight past them, walk into school. But hopefully, as I say, we will see positive action from the police. I think just the police being there is a useful deterrent to people anyway. But if they persist, then hopefully action will be taken. Any other comments on the COVID response?
Thank you, Chair. Just a question to you, Graham. In terms of the rates that you shared with us of staff take-up of the first and then second dose, could you just give us a bit of context? Are they numbers you'd expect? Is that where you'd have hoped them to be? Is that where other local authorities are? I'm not sure whether they're good or bad.
Thank you, Councillor Frost. My understanding is it's higher numbers than have been achieved in other areas, isn't it? And it's the highest percentage across the Liverpool City region. And we are very pleased with that level. Clearly, we want to get to 100% if at all possible, because it is now mandatory for all care home staff to have been vaccinated. But I think it represents a really significantly high number. Jane, did you want to?
Yeah, thank you, Graham. Yeah, we have got the highest vaccination rate across the Liverpool City region, and we are the only local authority given that high vaccination rate that has enabled us to take that off our risk register. And we did provide a member briefing on the vaccination rate into care homes that you will have had. And we also did a targeted piece of work with maternity services, given that some of the people that were resistant to the vaccine were people that were either concerned about fertility or maternity. So our midwife service did support people in their understanding and knowledge and experience, which did help us to increase the vaccination rate for that cohort of staff.
Councillor Walsh.
Just to follow up on that, obviously, if there's a medical exemption, those people don't need to get vaccinated, those carers wouldn't need to be vaccinated. Do we know what a percentage is like full saturation? Because it wouldn't be 100, so do we know what that number would be?
I think the national target is between 84 and 86%, but I can confirm that. So we are higher than that already with our 94% for the first vaccination.
If there's nothing else, can we have a mover and a seconder, please, for the recommendations that we note the contents of the report and the progress? Councillor Frost and Councillor Cannon, thank you. Work programme, over to you, Vicky.
Thank you, Chair. Members, the purpose of this report is to ensure that you have the opportunity to contribute to the delivery of the committee's work programme. Members will see from the report in front of you that you do already have quite a full work programme, but I would invite members to express any comments they may have in relation to this, or if there's any further items you would like to add to the work programme. We'll be pleased to hear your comments.
Councillor Gilchrist.
Well, we had an earlier discussion, Chair, about capital, both on the electronic side, but also on the planning, finding sites, planning building and getting intermediate care premises updated. I think spokespersons, we had discussion about asking officers to come to us as soon as they can with ideas about sites and to see what the obstacles might be. And perhaps we could have an early report on where we can go, because we have programmes that have peaks and troughs, but we want a steady growth in the service to reach the target that we've had in mind. Thank you.
So are you suggesting that you want something on the work programme then? On
yes, thank you,
extra
Chair.
care housing developments, yeah. Right? Anyone else looking for more work? Yes, Councillor Cannon.
Sorry, Chair, maybe it isn't any more work, but I do remember prior to going into the committee system, we'd had quite an extensive report on the opening of the urgent care facilities and centre at Arrow Park, and I know that there was supposed to be a report coming back to us once that had been reviewed. Now, I totally understand that with COVID maybe that hasn't happened, but I just don't know if there is somewhere in that maybe somebody has an update for us, or if that's possible, because it must be a couple of years now, isn't it? I can't remember, time flies, but thank you.
Yeah, I'm sure that our officers can either get an update or we can have somebody here from the CCG who can update us on that.
Yeah, just I mean, obviously, you know, if it's going to take time, we can all read, so, you know, you can come to the report, whatever's going to be easier.
Well, it's not urgent care, it's not urgent, yeah. I mean, I am aware, for instance, that walk-in centres are no longer walk-in, you have to make appointments. So I don't know whether that's something that, the sorts of things you want to raise.
I think so, Chair. I think that was, we were, when obviously we were presented with the model and the closing of those particular walk-in centres and the increasing of dressings clinics that would be appointment-led, etc., etc. And I think we were just expecting a review of that and the outcomes as to the admissions through urgent care, the admissions into the walk-in centres. And I said I was just looking at the work programme, aware that another year may slip by without us actually having a report back from I think it was Dr. Cowan actually, but whoever is now taking over. Thank you.
Councillor Gilchrist.
Yes, well, thank you, Chair. It's fair to say there were several elements to this. Walk-in centres, yes, there have been occasional short-term closures at Easton, but I've followed each one of those up. One to do with water supplies and electrical work, and the other because of shortages of staff. But I think the key thing was that they have an important role to play now and still. The second element was there going to be a remodelling of emergency department at Arrow Park. As someone who spent a few hours sitting in it recently and then 3 days in a ward, I can see, having sat there and see staff working in those incredible conditions and working incredibly hard, checking whether I'd had a stroke and all sorts of exciting things. They are interesting conditions to work in, and very cramped conditions to work in. And whilst you try and make these places pleasant, attractive, well painted and the rest of it, the pressures on staff are enormous. And I think we had a meeting where Simon Banks was assuring us that there had been a slight increase in people coming to emergency department who might have been dealt with in the primary care network, and he was anxious to sort out any difficulties that were leading to that. And the walk-in centres and the primary care networks had a key role to play in ensuring people were treated appropriately.
Yes, indeed. It will be interesting to have that update. So thank you for that, Councillor Callan. Anything else people want to put on the work programme? No. Okay. Thank you. Happy to move that with that addition, that item, that we will note, we'll add that item and then note the rest of the work programme. Yes.
Yes.
Second. Oh, have you seconded that? Thank you. Thank you, Councillor Callan. And on that note, I think we have reached the end of the meeting. Thank you all. I think we've done that in record time as well, considering it was a fairly large agenda. Thank you all very much. It's been some really serious issues considered tonight, and we've managed to get through them in a pretty good time. So thank you all very much. Thank you for your cooperation and your participation tonight.